The environment of UCSF was a microcosm of the world that really not only prepares you to be a good physician, but it actually emphasizes the compassion, the humanistic approach, and has access to very diverse populations which reflect the world that we're in. So that was truly a gift, being able to go to UCSF.
I graduated from the graduate division, the Department of Physical Therapy and Rehabilitation Sciences. The field of physical therapy really allows you to develop some strong relationships with patients, teaching someone how to walk again or to recover their function. And there was also just this real desire that I knew I wanted to do global health. But when I was in school as a student, there really wasn't a lot of global health opportunities in physical therapy. But I had a lot of support from the faculty in kind of bringing together those two fields. And UCSF really fostered that.
I graduated from UC San Francisco School of Pharmacy in 1983. After graduating from UC San Francisco, it was wonderful to be able to help one patient at a time, but very quickly I wanted to start helping more and more patients. And when the opportunities came, I wanted to grow with that. And I've been working with Direct Relief as an employee for about 18 years now. And Direct Relief is a nonprofit organization, and we're now working in about 100 different countries doing both disaster preparedness, disaster response, and ongoing care. I was able to bring in my expertise from pharmaceuticals. They brought in their logistics, and we were able to work together so that now we're the largest charitable pharmacy organization in the United States.
I was born in New York City. I did drop out of high school. I disappointed my mother, and I enlisted in the Army and then deployed to combat in Vietnam. And eventually I was injured in combat. I came home and went back to school. And then I was fortunate enough to do well in school and apply to a number of medical schools. And eventually I got to UCSF. I was in the School of Medicine at UCSF, and my class was the class of 80. It was a mecca for me. And it was a launching pad for the rest of my life.
In recent years, a lot of my work has really focused on capacity building, really providing robust training for healthcare workers, because the whole world has an unmet rehabilitation need. And it's particularly noticeable in some of the global settings and low-income settings where the number of physical therapists is nearly non-existent. So that's really informed my global health work. I worked in the eastern part of the Democratic Republic of Congo, and I lived there for about 2 years. And the hospital I happened to be working with early on also treats a high volume of women who are survivors of sexual violence. And what has been remarkable is to see how the healthcare workers at this facility have just taken all of this knowledge of physical therapy and rehabilitation, and they've started their own programs for pregnancy and postpartum. Being able to bring rehab services and physical therapy to those communities in the most need is incredibly impactful.
The training I received from UCSF in asking questions and thinking of solutions has made a huge difference in my role at Direct Relief. Following a disaster, more people will die from lack of having their chronic disease medications than usually from the disaster itself. When people have to evacuate suddenly, they frequently will not take their chronic disease meds with them. So we were able to develop these kits that are very portable, that are pre-hurricane kits that have a lot of the chronic disease meds to try to keep as many people healthier during a very stressful situation. And we now have different ones for international disaster kits that we have immediately available to deploy. And I'm very proud to have had this experience working at Direct Relief and being able to know that we're helping people that are most in need.
UCSF prepared me to do a lot of things. I've been a police officer as well, and a paramedic, a registered nurse. But one of the jobs that I think UCSF greatly assisted in preparing me for was to become Surgeon General of the United States. I think that the Surgeon General has the opportunity to step forward and to be able to provide good science information to those who need this information to embark on good prevention and care programs. The job description is to protect, promote, and advance the health, safety, and security of the United States, and it's really a privilege. I knew it's going to be difficult, but if I just stay true to my values that my mom gave me and what I learned at UCSF, I'll come out of this okay. And I became the first Surgeon General in history to be confirmed unanimously by the U.S. Senate. The opportunity to show a good face of America, what we really represent, what the values are. Again, it goes back to UCSF, all those values that were there that were instilled upon us in working with diverse populations and subordinating our own interests for the greater good.